Penile cancer is a rare form of cancer that affects the skin and tissues of the penis. It occurs when abnormal cells in the penis grow uncontrollably, forming a tumor. This type of cancer is typically slow-growing and often curable, especially when detected early. Understanding the causes, symptoms, and treatment options for penile cancer is crucial for early diagnosis and effective management. The exact causes of penile cancer are not fully understood, but several risk factors have been identified. These include a history of sexually transmitted infections, particularly human papillomavirus, HPV, smoking, and a weakened immune system. Treatment options may include surgery, radiation therapy, chemotherapy, or a combination of these approaches. Early detection and treatment are key to achieving the best possible outcomes for penile cancer.
The history of penile cancer dates back centuries, with documented cases found in ancient medical texts. However, due to societal taboos and limited medical knowledge, the understanding and treatment of this disease remained rudimentary for a significant period. It wasn't until the advent of modern medicine that a more scientific approach to understanding and treating the disease emerged. Breakthroughs in surgery, anesthesia and chemotherapy in the 20th century revolutionized penile cancer treatment, offering new hope for patients. Despite these advancements, penile cancer remains a relatively rare disease, accounting for less than 1% of all cancers in men. With continued research and development, the medical community is striving to improve diagnostic techniques, treatment options, and ultimately the prognosis for individuals diagnosed with penile cancer.
While the exact causes of penile cancer are not fully understood, several risk factors have been identified that can increase a man's likelihood of developing the disease. These risk factors can be broadly categorized into lifestyle factors, medical conditions, and genetic predisposition. Smoking, for instance, is strongly linked to an increased risk, as it weakens the immune system and exposes the body to carcinogens. Similarly, a history of sexually transmitted infections, particularly human papillomavirus, HPV, is a major risk factor. Certain medical conditions can also increase the risk of penile cancer, such as phimosis and lichen sclerosis. These conditions can lead to chronic inflammation and irritation, potentially contributing to cellular changes that lead to cancer. Men with a family history of the disease may have an inherited predisposition that increases their risk. By adopting a healthy lifestyle, practicing safe sex, and seeking medical attention for any concerning symptoms, men can significantly reduce their risk of developing penile cancer. Penile cancer often manifests with noticeable symptoms, making early detection possible. Being aware of these signs and seeking prompt medical attention is crucial for successful treatment. One of the most common symptoms is a change in the skin of the penis, such as a lump, sore, or ulcer that does not heal within a few weeks. These changes can appear anywhere on the penis, including the head, shaft, or foreskin. Other symptoms include unusual discharge from the penis, bleeding, and a thickening of the skin. Some men may also experience swelling in the groin area, indicating the spread of cancer to nearby lymph nodes. Early detection and treatment of penile cancer offer the best chance for a cure.
Laboratory investigations aiding diagnosis. Laboratory investigations play a crucial role in diagnosing penile cancer and determining the stage and extent of the disease. A biopsy is the most definitive test for diagnosing penile cancer. During a biopsy, a small sample of tissue is removed from the suspicious area and examined under a microscope for the presence of cancer cells. In addition to biopsy, blood tests may be ordered to assess the patient's overall health and check for any underlying medical conditions that may affect treatment. Imaging tests, such as ultrasound, Connecticut scan, or MRI, may be used to determine the extent of the cancer and whether it has spread to nearby lymph nodes or other organs. These imaging techniques provide detailed pictures of the inside of the body, allowing doctors to visualize the tumor and surrounding tissues. The results of these laboratory investigations help healthcare providers determine the stage of the cancer and develop an individualized treatment plan. Diagnosis and beyond. Differentiating penile cancer. Diagnosing penile cancer involves a multi-step process that begins with a thorough medical history and physical examination. The physical examination allows the doctor to visually inspect the penis for any abnormalities, such as sores, lumps, or changes in skin color or texture. The doctor may also feel the groin area for any enlarged lymph nodes, which could indicate the spread of cancer. If penile cancer is suspected, a biopsy is typically the next step in the diagnostic process. Differential diagnosis is an important aspect of diagnosing penile cancer, as several other conditions can cause similar symptoms. By carefully considering the patient's symptoms, medical history, and the results of laboratory and imaging tests, healthcare providers can accurately diagnose penile cancer and differentiate it from other conditions. The surgical approach treatment options. Surgery is a common treatment option for penile cancer, particularly in the early stages of the disease. The type of surgery performed depends on the size and location of the tumor, as well as whether the cancer has spread to nearby lymph nodes. For small, localized tumors, surgery may involve removing only the cancerous tissue and a small margin of surrounding healthy tissue. This is known as Mohs surgery and is often performed on an outpatient basis. In cases where the tumor is larger or more invasive, a partial penectomy may be necessary. This procedure involves removing the part of the penis where the cancer is located, while preserving as much of the remaining penis as possible. In advanced cases, where the cancer has spread extensively, a total penectomy may be the only option. Following surgery, patients may require additional treatments, such as radiation therapy or chemotherapy, depending on the stage and aggressiveness of the cancer. Beyond surgery, chemotherapy and radiotherapy. In addition to surgery, chemotherapy and radiotherapy are important treatment modalities for penile cancer, often used in conjunction with surgery or as standalone treatments, depending on the stage and extent of the disease. Chemotherapy utilizes potent drugs that interfere with the growth and division of cancer cells. It can be administered intravenously or orally, reaching cancer cells throughout the body. Radiotherapy uses high-energy rays to target and destroy cancer cells in a specific area. It can be delivered externally using a machine outside the body or internally by placing radioactive material directly into or near the tumor. The choice between chemotherapy, radiotherapy, or a combination of both depends on factors such as the stage of the cancer, the patient's overall health, and the potential side effects of each treatment. Treatment decisions are made in consultation with the patient and a team of healthcare professionals, ensuring the best possible outcomes.
Prognosis and follow-up. Life after diagnosis. The prognosis for penile cancer largely depends on the stage of the disease at diagnosis, with early-stage cancers having a significantly higher survival rate than advanced-stage cancers. Regular follow-up care is crucial for monitoring the effectiveness of treatment, detecting any recurrence of the cancer, and managing any long-term side effects. Following treatment for penile cancer, patients will have regular checkups with their healthcare team. These checkups may include physical examinations, blood tests, imaging tests, and biopsies, depending on the individual's case. In addition to monitoring for cancer recurrence, follow-up care also focuses on managing any long-term side effects of treatment. Support groups and counseling services can be invaluable resources for individuals coping with the emotional and social impact of penile cancer. These support systems can provide a safe and supportive environment for sharing experiences, accessing information, and connecting with others who understand the challenges of living with penile cancer.
The importance of early detection. Your health matters. Early detection is paramount when it comes to penile cancer. When diagnosed and treated in its early stages, penile cancer has a high cure rate. Regular self-examinations are an essential part of early detection. Men should become familiar with the normal look and feel of their penis and be on the lookout for any changes, such as sores, lumps, or discoloration. If any abnormalities are detected, it is crucial to consult a healthcare professional without delay. In addition to self-examinations, maintaining good hygiene habits is important for penile health. By prioritizing their penile health and seeking timely medical attention, men can significantly improve their chances of detecting penile cancer early, increasing the likelihood of successful treatment and a positive prognosis.
Knowledge is power. Penile cancer, while a relatively rare disease, can have a significant impact on a man's physical and emotional well-being. If you like our content, give us a like, subscribe, activate the bell, and share this video so more people can see it. Understanding the causes, symptoms, and treatment options for this disease is crucial for early detection, effective management, and improved outcomes. By promoting awareness, encouraging regular self-examinations, and breaking down the stigma surrounding penile health, we can empower men to take charge of their health and seek timely medical attention when needed. If you or someone you know has concerns about penile cancer, do not hesitate to reach out to a healthcare professional. Early detection and treatment offer the best chance for a positive outcome.